Hi everyone, Ish again from Bite Dental Center. Today, on this unusually cold Monday in Annapolis, I wanted to talk about oral hygiene instruction, that code that a lot of you had questions about. And the questions, the confusions, I have been addressing them by email with each of you who reached out, and my team has been speaking with you as well. But I figured it would be helpful if I give you an overview from the top, what it is, why it came about, and the reason behind it. Because, of course, you deserve to know the full story. I don't want any of you to be in confusion or something. So, how does the code work and how we approach it? Something we do every year. We receive two books. We purchased two books. Let me show you. This is the coding companion book that we have for 2026. Coding book, sorry, the code book, the dental terminology. This is the companion book. You see the flags of different codes and where they're applicable. We get these for every year. Every year we get these books because they are the authority on what the codes are, what should be treated, and how that should be done. We review every year to maintain our compliance and to update everything accordingly in our system. Historically, we reviewed the books to track which codes are active in the coming year and which codes have been deprecated. That's because that happens constantly. The ADA may have a code that's active one year, make it inactive the next year, and then introduce a revised code in its place, and then change after. So we review, we adjust, we update, we submit claims, and we move on. Last year, as part of this relocation and moving that we did to our new Annapolis office, we did a comprehensive review of the codes we use and the work we, actually do. Around October of last year, I believe, I sent a detailed email about this, and I'll be honest, a lot of you probably didn't read it or didn't pay much attention to it, and I probably didn't call it out clearly enough. So when we did include that notice, it wasn't heard as widely as we had expected. So what is the OHI code, the Oral Hygiene Instruction Code? What is it and what does it do? As we went through our review, we looked very closely at the most common codes for a preventive hygiene visit or the routine visit. You have the prophy code D1110 and you have the doctor's exam D0120. If you look up the description of these codes, right, I encourage you to do it. If you look up the description of the prophy code, you will see that it covers scraping and polishing. That is it. It is entirely about the mechanical act of removing buildup from your teeth. Everything else your hygienist does, everything else the doctor does, it's not included. The doctor's exam is a quick visual check for an existing patient, nothing further. So, if you pause at the end of your visit and ask yourself, what did I learn today? What did we discuss that goes beyond the mechanical cleaning and the brief visual check? The answer at Bite is quite a lot. We do significantly more than what those two codes describe because we have a highly trained team, an experienced team, and a team where someone attends continuing education every single month. We go out there, we learn, and we bring that back to you to ensure that we have a very, very, very high standard of care. As a health first organization, yes, we're a business, but health comes first. As a health first organization, we have always been committed to maintaining the highest standard of care, which is why some of what we do doesn't even have a code. The best example of it is laser therapy. It is still something that has not made its way to the ADA codes because the ADA codes are based on the treatment outcome, not the advanced tool or technology or technique. They have codes for blades and bleeding, but they don't have codes for, laser and healing. That will come. It has happened with other codes before, right? That will come. That's why they revise the codes every year. But there is a gap between clinical excellence and coded recognition, right? And now there's a further gap between the code that the ADA has and what the insurance carrier will actually cover. Many of you have plans, for example, where we submit a porcelain crown code, D2740. That is the prevalent technology of the day. We submit a code for a porcelain crown, and the carrier downgrades it to an alternate benefit of a metal crown. That's a 30, 40-year-old technology. That's not what we do here, but they downgrade because that's where the insurance companies are. There's always a lag, right? There's the best care, there's the ADA code, and then there's insurance coverage. These are very different timelines. It's important for you to understand because I am noticing this trend, and I believe that we could have done a better job of communicating this because that helps address a lot of these questions about billing and the services and what we do and why. Now, what's the clinical reason why we considered the OHI code? Research shows, and again, you should do your own research as well. Research shows that approximately 70% of patients aged 60 or older have some level of periodontal disease. That's across the population. And our median patient age is 67, 68. So you can see where we are. So about 7 out of 10 patients have this. And I'll share something very personal. It doesn't have to do with age, right? I brush my teeth more than most people do in a given day, at least a dozen times. But I still have periodontal disease. I have that predisposition from my father's side. My mom, whose brushing habits I can only describe charitably, has perfect gums, and it runs on her side, but it's not in me, and I had to manage that from a very young age. It feels unfair, but I have to. That's where I am, right? Because once periodontal disease sets in, there is no reversing it. There's no path back. And the research is increasingly clear that this oral bacteria does not stay in your mouth. It travels. It has been found in patients with heart disease, in patients with diabetes, and just recently, I just read a Johns Hopkins report and another research publication that came out in January of 2026 that it's linked with patients who have Alzheimer's. So it's not hypothetical. This is documented. It is important, and that is why the hygiene appointment in our offices, it's not just a cleaning. It's an opportunity to identify disease early and to intervene early. When we hire and train our hygienists, the first thing I tell them is that their role is a sacred responsibility, a really, really, really serious and sacred responsibility. A hygienist is the healthcare provider a patient spends the most time with in a year, at least twice annually, 1 to 2 hours each visit, one to one, dedicated. Compare that to your annual physical. Someone takes your vitals, someone draws your blood, you fill out the forms. You may have 10 to 15 minutes of actual conversation with a physician if you're lucky, sometime with a nurse perhaps. That's it. So that's why it's so important that we take a whole health approach and take the time to educate you. When you come to a hygiene visit, right? Every other appointment, or at minimum once a year, we take an updated periodontal chart. You hear the hygienist call out the numbers, 1, 2, 3, 4, 5, the numbers, right? The numbers 1, 2, and 3 indicate healthy gums, no issues. 4 and 5, you're, in that stage where you may have early stages of gingivitis. Gingivitis is still reversible at that point. And if you move beyond that into that area where you have deep pocketing and bleeding, you're entering periodontal disease territory, and from there there's no return. That's the window, a very narrow window. That is where that oral hygiene instruction code applies, and if you go beyond, obviously it applies as well. So in patients who show deeper pocketing or early warning signs, we take the time to have that conversation. Our hygienists have been doing that for years. We've always done it. What changed is that we're now coding for it because we are required to document it. That's the whole point of the compliance review. What are we doing and are we documenting it, right? So that's where it represents and documents and records a clinical service that has been given to you. Now, to be transparent about something, we don't particularly care about collecting for this code. It's a large operation here. It's a really large operation here. We help patients with complex cases every single day across all our offices. And what we genuinely care about is keeping you healthy. There's no greater satisfaction in this practice than watching a patient turn around from active disease. We would rather do that than manage advanced treatment that could have been prevented. That's why the OHI code is a trigger. It's a it's a documented default nudge to the provider that this patient needs more than a mechanical cleaning, right? It applies to patients with, and according to these are the flags, right? According to the ADA's scenarios that they presented, it applies to patients with periodontal disease, with high sugar diet, with missing teeth, patients who have implants, dentures, patients who use marijuana, patients who are bleeding. These are actual examples of when the requirement and responsibility is to educate you. So, for those patients, we don't just clean your teeth, we educate you so that your health does not decline further. Now, I want to be upfront about something else that you will see more codes like this going forward. There is what's it called? There's a remineralization technology that is becoming more accessible. If your decay is caught early enough, we can remineralize it so that the tooth is restored, so that the tooth does not progress, that the cavity does not restore to a point where you need a filling, or worse, a root canal, or worse, a crown, or worse, an extraction and then an implant. We are trying to prevent that because the intervention window is narrow. The technology is there. The final outcome, which is more drastic, is already there. How can we help you ahead of time? So it's yes, saving you time, it's saving you discomfort, but it's also keeping you healthy. That's the focus. Now, going forward, right, we are now coding for tobacco counseling, which we've always been doing. We've discussed it with patients all the time, but we never formally documented it. We just acquired specialized equipment for oral cancer screening that goes beyond a visual check of whether there's a lesion, something looks a little bit off. Do we check? Was it the same before? Let's look up a picture. No, it's something that shines a specific frequency of light that identifies abnormalities, right? That the naked eye can't always detect or can't detect with confidence. We have rolled out oral DNA testing where we identify what kind of bacteria you have more of a predisposition towards, and based on that, we give you the medication or we recommend treatment because there's no point blasting you with antibiotics without knowing what we're going up against. Um, we have home sleep apnea testing. So these are advanced standards of care that aren't fully reflected in the existing codes, but they're part of what we do. So I hope this background is helpful. I am making a commitment to you from my side that I will do a better job. I'll make sure that my team does a better job of ensuring that you have proper explanation of what's happening and why before, during, and after your visit. And you should be, as our patient, you should be fully informed and fully involved in your care decision. This is a non-negotiable for us, right? We want you to be informed and we want you to be involved. That's the whole point of us going out of our way to educate you. And if there's ever a code in your bill that you do not understand or that you do not believe applies to your visit, bring it to my attention directly. Email the office, send a message, or email me at ish@bytedentalcenter.com. I will look into it as quickly as possible. I am going through the entire backlog and I've been responding to each of you personally. Right? We have safeguards in place, we have reviews in place, but still mistakes can happen. If we have made any, please bring me to my attention. I will take care of them. On our side, every hygiene visit, and in fact every restorative visit with the doctor as well, starts from a checklist of services. Whatever doesn't apply, we remove. But errors happen, like I said. Errors happen, and when they do, we correct them. As always, email me, I will take care of it. Email, text, that's usually the best way to get me. So that, I hope, covers it. If you have any questions about this code or any billing issues, please bring it to my attention. And I hope we finally get started with spring again. Thank you.